When most people hear the words cancer surgery, they maybe picture something like this. A tumor is found. A surgeon removes it. Problem solved. But that is not really all that's actually happening. And hearing "we got it all," of course, is wonderful, but it's not the same thing as hearing "you are done." Cancer surgery is performed by brilliant, specialized surgeons, and it is a carefully planned part of cancer treatment. It is not just about cutting something out. It is about deciding what needs to come out, why it needs to come out, what needs to stay, how to reduce the risk of cancer cells being left behind, and how to preserve as much normal function as possible. It is about survival, but it is also about speech, swallowing, digestion, movement, identity, and quality of life. So what exactly are surgeons doing during cancer surgery? How do they decide how much to remove? Why do some people need lymph nodes removed? And what does all of this mean for your body and your recovery afterwards? In this episode, we are going to walk through cancer surgery in plain language so you understand what is happening and why. This is part 2 of our 4-part Cancer 101 series. We're building this step by step. In the last episode, episode number 9, we talked about what cancer is and how a normal cell turns into a cancer cell. Now we're going to talk about one of the most common and often the first cancer treatments people experience: surgery. Let's talk about it. This is the After Cancer Podcast. I'm your host, oncology physical therapist, Dr. Leslie Waltke. For more than 3 decades, I've walked alongside people living with and beyond cancer. Whether you are a survivor, a caregiver, or part of a clinical team who cares for them, I'm glad you're here. Because life after a cancer diagnosis can feel uncharted and confusing, even when you have a great medical team. In this podcast, evidence, empathy, and the real human experience come together to help you navigate the physical, emotional, and practical realities of cancer and the life that comes after. This is the After Cancer Podcast, rooted in medicine, spoken in human. Hi, After Cancer community. Welcome back. This podcast is brought to you in partnership with Cure. Welcome to episode 10, Cancer Surgery 101. For many people, surgery is the first major treatment they experience after a cancer diagnosis. It is often the first moment when cancer shifts from something you heard about from a pathology report or saw on a scan to something that is physically happening to you and your body. There is a date on the calendar. There are pre-op instructions. There is anesthesia. And there is often a whole lot of fear. People ask, what exactly are they going to do? How much are they taking? Will they get it all? What will I wake up feeling like? How long will recovery take? Will I be able to move normally again? These are real questions. So today, we are going to talk about what cancer surgery is, why it is used, how surgeons make decisions, what terms like margins and lymph nodes actually mean, and why recovery is often much more than simply waiting for an incision to heal. At its core, cancer surgery is the physical removal of cancerous tissue from the body. But that simple definition leaves out a lot that also matters. Surgeons are not just removing a lump of tissue, they are making strategic decisions about how to remove disease while preserving as much healthy tissue and normal function as possible. They are working with imaging, pathology, anatomy, and the location of the tumor, the probable stage of the cancer, and the realities of how a person needs to live after the operation is over. They are not going to put you through a surgery that does not have a specific intent, benefit, or purpose. This is why you most likely go through a lot of testing, staging, and imaging before you go to surgery. It is often brutal, but it is really necessary. One of the most important concepts in cancer surgery is the idea of margins. When a surgeon removes a tumor, they obviously want to take the tissue where the mass has been found on imaging. Yet they will also typically aim to remove a rim of tissue around it. This is because individual cancer cells can extend beyond what is visible on imaging and to the naked eye. They don't want to leave any of those cells behind. But they also don't want to do any unnecessary damage by unnecessarily removing too much tissue. So cancer surgeons are constantly walking a very careful line, taking out enough tissue to remove the cancer effectively, while avoiding taking more than necessary and potentially causing unnecessary harm to normal function. So after the tumor and this margin of tissue is removed, a pathologist examines it under the microscope. If no cancer cells are seen at the edges, this is called a clean or negative margin. If cancer cells are present at the edge, this is called a positive margin, and it may suggest that some microscopic cancer is still in the body. Remember, there is no way for the naked eye to see individual cells. Sometimes positive margins mean more surgery is needed. This is one reason why a person may think the surgery is done, only to learn later that additional treatment or even another operation is recommended. Another part of many cancer surgeries involves lymph nodes. The lymphatic system is one of the routes which cancer cells can use to spread. So a great way to check for possible spread is to look at the lymph nodes in the area around the tumor. Unfortunately, the only way to know if there are cancer cells in a lymph node is to take it out of the body and put it under a microscope. So during surgery, nearby lymph nodes are often removed so they can do exactly that, to put it under a microscope to see whether any cancer cells have traveled beyond the original tumor. You may hear terms like sentinel node biopsy or lymph node dissection. A sentinel node is the first node or few nodes that drain that tumor area. If those nodes are free of cancer, more extensive node removal may not be needed. Another really hard part of this process is that it can take several days to get the final surgical and lymph node pathology results back after surgery. That waiting period can be brutal for people. The surgery may be over, but the uncertainty is not. While that waiting period can feel difficult, this information is incredibly important. It helps your care team understand more accurately the cancer and therefore make the best decisions about what should come next. There are also different intents of cancer surgery, depending on the goal. Some surgeries are curative, meaning the intent is to remove all known cancer. Some are diagnostic, like a biopsy, where the goal is to obtain tissue so the physicians can identify exactly what they are dealing with. Some are preventative surgeries, such as removing tissue in a person with a very high inherited risk of developing some cancers. And some surgeries are palliative, meaning they are done not to cure the disease, but to either slow it down or to relieve symptoms. Now let's talk about when cancer surgery can become deeply personal. In breast cancer, some surgeries may leave the chest looking and feeling different. Some intestinal cancer surgeries may require an ostomy. In head and neck cancer surgeries, it can affect speech, swallowing, chewing, appearance, and even breathing. In cancers around the pelvic floor, surgery may affect fertility, hormone function, sexual health, or bladder and bowel function. Some lung cancer surgeries can affect breathing. So surgery is not just about getting cancer out, it is also about what the body will still be able to do afterward. I remember a woman who had abdominal cancer surgery telling me, I thought once they removed the cancer, I'd just start getting better. But after surgery, she found herself in a body that felt weaker, tighter, and more foreign than she expected. Rolling over in bed hurt. Standing fully upright pulled across her abdomen. Her digestion changed. She tired quickly. Yes, she was relieved the tumor was out, but also deeply unprepared for how much recovery would ask of her physically and emotionally. That experience is incredibly common. People are often told about the surgery, but afterwards not always adequately prepared for the reality of recovery. I also think about a patient who underwent head and neck surgery and later said, I never realized how much energy it takes to relearn normal things. He was not just healing from an incision, he was relearning how to eat, how to speak clearly, how to navigate being seen in public in a body that looked and felt different. Cancer surgery can be life saving, but it can also be life altering. Both of those things can be true at the same time. Again, this is why so much planning happens before surgery even starts. There may be imaging, lab work, anesthesia evaluations, medication changes, fasting instructions, and discussions about risks and benefits. Your cancer case is often discussed with the entire team before the surgery. Some people will receive different treatments like chemotherapy and or radiation before surgery to shrink a tumor or make the operation more effective. Others have surgery first and then receive treatment afterward. Remember, surgery usually does not happen in isolation. It is one part of a broader cancer strategy. Yet after the surgery, recovery does eventually begin. And this is where I want to put a very strong emphasis, because recovery is not just about the incision. Recovery is about the whole person. The body has to heal tissue, manage inflammation, restore mobility, rebuild strength, and recalibrate around whatever anatomical change just took place. Yes, many people do come out of some cancer surgeries with very little effect and are back to normal very quickly with very little effort. Yet many people may have pain, swelling, fatigue, numbness, tightness, weakness, altered posture, fear of movement, and a drop in activity tolerance. There is also the potential of surgical deconditioning. When the body is less active, even for a short period of time, muscles begin to weaken, endurance drops, walking can become harder, stairs feel steeper. Balance can change, and for people who are already worn down by cancer itself or treatment before the surgery, are elderly, or just generally not in great shape, that deconditioning drop can be even more dramatic. This is one reason rehabilitation matters so much. Recovery is not simply waiting on the couch for things to get stronger. It is active, guided rebuilding. Scar tissue is another major factor that many people are affected by. Scar tissue is a normal part of some postoperative healing, but scar tissue does not always behave exactly like the tissue that was there before. It can become thick, restricted, tender, or stuck to nearby tissues. It can affect movement around the shoulder, chest wall, abdomen, neck, hip, pelvis, or wherever the surgery occurred. It can contribute to pain or that pulling, tight, not quite right feeling patients describe so often. And then for some, there may be lymphedema risk after some surgeries that involve lymph node removal or radiation to the lymphatic regions. So persons that have had lymph nodes removed should talk to their surgeon about their surgery to, one, find out if they are at risk for lymphedema, and if they are at risk, what is their specific risk? What is the timeline for that risk? And what can they do, if anything, to minimize that risk? Ultimately, we want all people after cancer surgery to understand that just like someone who has had an orthopedic knee surgery or shoulder surgery, they too have the right to expect to regain their full potential functional and comfort levels. This is one more reason that a rehab lens really matters. Surgery is not only about tumor removal. It can change movement, comfort, and long-term function in ways that patients are not always fully counseled about in advance. This is exactly why rehabilitation should not be an afterthought after cancer surgery. Cancer rehabilitation can help people regain range of motion, improve breathing mechanics, restore strength, reduce fear of movement, improve endurance, address balance issues, work through scar restrictions, and return more safely to daily life, work, caregiving, exercise, and intimacy. Sometimes rehab is about a shoulder that will not lift. Sometimes it is about pelvic pain, abdominal weakness, dizziness, gait changes, or profound fatigue. Sometimes it's about helping someone trust their body again. All of that counts as recovery. There is also a psychological and emotional side to surgery that we cannot ignore. Surgery can leave people feeling relieved, grateful, terrified, angry, numb, disfigured, hopeful, or all of those at once. Some people feel enormous pressure to be thankful because the cancer was removed, even while grieving what their body has lost. Some struggle when family members assume they should be back to normal because the operation is over. But surgery does not instantly restore normalcy. Sometimes a surgery is the beginning of a much longer chapter. As mentioned previously, today oftentimes cancer surgery is one part of a multidisciplinary plan. Surgeons work with medical oncologists, radiation oncologists, radiologists, pathologists, nurses, physical therapists, and sometimes plastic or reconstructive surgeons. That team approach is important because surgery rarely is the whole story. A person may need chemotherapy before surgery, radiation after surgery, rehabilitation, and support around body image, fatigue, and functional change. This, again, is exactly why hearing "we got it all out" is not the same thing as hearing "you are done." So here's what I want people to most understand. Cancer surgery of today's era is extraordinary. It can remove disease, save lives, reduce pain, prevent future problems, and create a path forward. But it is not simple and is not minor just because it is common. It is a major biological event for the body and often a major emotional event for the person living through it. And patients deserve to be prepared not just for the operation itself, but for the recovery, the adaptation, and the support they may need afterward. Now, as you reflect back on this episode, think about a few questions. If you have had cancer surgery, what surprised you the most? The operation itself, the pathology waiting, or the recovery afterward? Did anyone prepare you for how your body would feel and function in the weeks after surgery? If you are heading into surgery coming up, what questions do you still need answers so you feel more informed and more prepared? If this episode helped clarify something that once felt confusing or overwhelming, consider sharing it with someone who is preparing for surgery or recovering from it. You'll find the resources and the link to join the podcast email list so future episodes get emailed directly to your inbox, all in the show notes. This, again, was just part 2 of our 4-part Cancer 101 series. Coming up in the next episode 11, we are going to shift to one of the most well-known and most misunderstood cancer treatments, chemotherapy. What chemotherapy actually is, how does it work, why does it affect healthy cells too, and why can the side effects be so different from one person to another? We're going to break all of that down in plain language. If you missed the first in this series, episode 9, on understanding cancer cells, you can find that link in the show notes as well, or you can click on the episode 9 end card that will pop up at the end of this video. Before we wrap up, a quick shout out to ABCD after breast cancer diagnosis. ABCD provides free, virtual, personalized emotional support by matching anyone impacted by breast cancer with a trained volunteer mentor who has lived a similar experience. Learn more about getting support or becoming a mentor at abcdbreastcancersupport.org. I'm oncology physical therapist, Dr. Leslie Waltke. Thank you so much for joining me today. I hope you found it helpful, and I look forward to your feedback, likes, and shares. As always, exercise like your life depends on it, because it does. And remember, cancer surgery is not just about what gets removed. It is also about what your body has to heal, relearn, and carry forward afterward. You are not weak if recovery feels bigger than you expected, and you are recovering from something big. You, my friends, are not alone, and you belong here. Peace out. Let's talk again soon.